What is good, everybody? This is Rafter Manuel from BSN4 Patricia Benner. The assigned topic to me is GTD or Gestational Trophoblastic Disease. The most common form of GTD is what we call the molar pregnancy or H-mole or Hydatidiform mole. And so I hope with the presentation that I made today, you will learn something. And so without any other further ado, let us dive into the presentation.
As I have said earlier, the most common form of GTD is what we call the molar pregnancy or the H-mole or hydatidiform mole. If you have read or if you have heard something about H-mole, hydatidiform mole, or molar pregnancy, iisa lang yan. They are all the same. But what really is H-mole? Well, let's get the statement of Garg of 2007. Garg stated that H-mole is a benign gestational trophoblastic disease developing during pregnancy characterized by the degeneration of the chorion, death of the embryo, and the abnormal proliferation of the villi. Iisa-isahin natin yan. H-mole is a benign. When we say benign, it is not harmful. And when we say degeneration, okay, we mean that as time passes by, the trophoblastic villi gets damaged. Garg also stated that H-mole is the death of the embryo. We all know that the embryo is the fertilized egg. The fertilized egg is the product when an egg and a sperm unite together, they become as one, okay, they become an embryo. And so, according to Garg of 2007, H-mole is the death of the embryo. What else? The abnormal proliferation of the villi. What is it? Villi is a finger-like projection, okay? Just like this. If it's in the singular form, it is called villus. But if it's plural, it is villi because there are so many of them. So Garg said proliferation, abnormal proliferation. When we say proliferation, it means it is the rapid increase or in Tagalog yung pagdami. And if there is a rapid increase in the villi, there will be the presence of fluid. As a result of this, there will be a grape-like structure. If you know the structure of grapes, you will have the idea. Okay? What happens inside the uterus is that there is a grape-like structure. Why? Because the HCG level of the woman abnormally increases. So if the HCG level of the woman arises or increases rapidly or abnormally, obviously there is a positive pregnancy. But not knowing that the high level of HCG becomes a risk in pregnancy. And so there are two types of molar pregnancy. Number one is what we call the partial mole and the complete mole. Partial mole, 69 chromosomes, while complete mole, 46 chromosomes. Let me do my best to differentiate the one from the other. Let's first go to the partial mole with 69 chromosomes. Now, here in the partial molar pregnancy, one egg is fertilized by not one but two sperm. Normally, in the anatomy and physiology of our reproductive system, one egg should be fertilized by one sperm. But in partial molar pregnancy, one egg is being fertilized by two sperm. Okay? The normal chromosome of sperm is 22 plus 1. So, that is a total of 23 chromosomes. We human beings, we have two sex chromosomes. It is the X and the Y. Now, we male, we have X and Y chromosomes in our cells, which is a total of either 23 X chromosomes or 23 Y chromosomes. In females, however, they have X chromosomes only. So, egg cells all contain an X chromosome. Wala yang Y. It's all X. Okay? While sperm cells contain an X or a Y chromosome. Because of this, if both male and female chromosomes unite together, so you do the math, 23 plus 23 equals 46 chromosomes. So that is the normal chromosomes in a fertilized egg, 46. But what happens in the partial mole pregnancy is that one egg is being fertilized by two sets of 23 chromosomes. So let's do the math again. 23 plus 23 equals to 46. Plus another 23 from the female, the egg is what? 69. Which is definitely abnormal. And I would like to reiterate again, the male produces either X or Y chromosomes, while the female produces only X chromosomes. So for example, okay, if a Y chromosome fertilizes an egg which is, sabi ko nga kanina, X-only chromosome, Y and X, the result would be XY, expect a male baby. But if an X chromosome fertilizes an egg which is again X-only chromosomes, when they unite together, the result would be 2X or XX. Expect a female baby. So what happens in partial molar pregnancy is that three sets of 23 chromosomes unite together. Meaning to say, it could be 69XXX, it could be 69XXY, or 69XYY. Therefore, there is the presence of fetal tissues in partial mole. Okay? Merong ambag yung babae, 23X chromosomes. Moving to the complete molar pregnancy, as I have said earlier, in the partial molar pregnancy, the fetal tissues are present. However, what happens in the complete molar pregnancy is that the fetal tissues are absent. Makikita nyo dito, wala na yung 23X chromosomes. Walang fetal tissue ang nabuo. Sa partial mole, meron. Kasi nga, merong X and Y. Meaning to say, merong chromosome sa babae, merong chromosome sa lalaki. Or there are chromosomes both in the sperm and the egg cell. Merong ambag yung babae sa partial mole. Okay? So what happens in the complete molar pregnancy? Normally, 23 chromosomes are present, but the egg is empty. The egg of the female has no chromosomes. Walang chromosomes, walang nucleus. So kapag walang nucleus, walang chromosome. We all know that chromosome is a DNA. So meaning to say, there are no nucleus found inside the egg cell. Walang DNA. Basically, what happens here is that the healthy sperm fertilizes an egg that has no chromosome. So the sperm notices that the sperm has no chromosome partner. Wala akong partner. It is empty. The egg is empty. So anong gagawin ko? As the 23 chromosome sperm fertilizes an empty egg, what happens to the sperm is that the 23 chromosomes duplicates itself. Kaya nga meron yung tinatawag na chromosome duplication. So the 23 chromosomes would become 46. The example here in the picture is 23x. So 23x times 2, that would be 46xx. Naging 46 nga, pero dinoble lang ang kanyang sarili, ang kanyang chromosome. It could either be 46 or 46XX or 46YY. It is because a sperm cell, as I have said earlier, could either be X or Y. However, there are some cases wherein two sperm, X and Y, fertilizes an empty egg. So ang combination nito is that 46XX, 46XY, or 46YY. So in general, in the complete molar pregnancy, the egg did not contribute any chromosomes at all. Lahat ng chromosomes ay nanggaling sa sperm. Lahat ng chromosomes ay nanggaling sa tatay. In the partial molar pregnancy, both egg and the sperm contribute 23 chromosomes. But two sperm fertilizes an egg. That is why it becomes 69 in total sa partial molar pregnancy. Okay? As I have said earlier, fetal tissues is absent, the egg is empty, all chromosomes come from the father. So here, makikita po natin, there is a risk, there is a probability that the female would have choriocarcinoma. And we all know that carcinoma is cancer. Choriocarcinoma, cancer in the chorion, which is the outer layer of the embryo, the outer layer of the fertilized egg. And so, if proliferation happened, there will be the presence of grape-like structure inside the uterus. That is the differentiation between complete mole and partial mole. Now, let us move on from the most confusing part of this presentation. Tapos na tayo sa partial mole and complete mole differentiation. Let us now move on, okay, to the signs and symptoms of H-mole. Number one, signs and symptoms of H-mole is that the woman misses her menstrual period. Why? Because fertilization occurred. Fertilization happened. Yes, abnormalities happen in the chromosomes of both the sperm and the egg, pero fertilization happened. Number two is positive pregnancy test. Why? You might be saying, wala namang fetus ang nabuo. Why? Positive pregnancy test? Because the pregnancy test detects what hormone? HCG. If the villi proliferated, the tendency is that the HCG level is also high. Meaning to say, the pregnancy test would detect the presence of HCG. Number three, excessive nausea and vomiting. Bakit? Because the HCG is out of the normal level, napakataas. Okay? So expect an excessive nausea and vomiting. Number four is vaginal bleeding. Ano ang kulay ng bleeding na ito? It's brown, color brown. Okay? Because separation happens in the lining of the uterus. Separation happens. Number five is tremors. Because of the high level of HCG, it's like having a high thyroid stimulating hormone. If the HCG is high, it causes tremors. Another is hyperemesis gravidarum. What is it? It is the excessive vomiting caused by a rapidly rising blood level of a hormone called, yes, HCG. Number seven is passage of grape-like structure. If in the 4th month or the 16th week, merong lumabas na grape-like structure from the vagina, it is one sign of H-mole. Why? Because the fertilized egg did not develop completely. Number 8, sign and symptoms is the rapid increase of uterine size. So the size of the uterus is not proportion. For example, it may be that the female is in her 14th week pregnancy, but the size of her uterus is the size of a 6-month pregnant. Okay? The rapid increase of uterine size. So let's now move on to the treatment. Okay? What are the treatments that we should expect, that we might expect with a female who is diagnosed with H-mole pregnancy? Number one is what we call the D and C, dilation and curettage. Sa Pilipinas, ito yung tinatawag natin na RASPA. It is a surgical procedure involving dilatation of the cervix and curettage of the uterus. It is to remove the chorion, villi that grow in the uterus. It must be cleansed, okay? Number two treatment is prophylactic chemotherapy. As I have said earlier, it could lead, or H-mole could lead to choriocarcinoma cancer. The doctor is avoiding this to happen, so they give the patient methotrexate, good for 1 year. Prophylactic chemotherapy. Number three is monitoring of the HCG level for 1 year. The initial level of the HCG must be recorded or must be documented to be used as a basis. Because if there would be an increase in the HCG levels, most likely chorionic villi would occur. That's why doctors recommend that the woman should avoid becoming pregnant during the first year after her diagnosis of H-mole. Because pregnancy, we all know that pregnancy would raise the HCG level, and it would be harder for the doctors to know if any molar tissues are left or if there is choriocarcinoma. Number four, treatment is for the doctor or even us nurses to advise not to get pregnant for 1 year. We should advise the patient not to get pregnant for 1 year. It is to avoid the regrowth of the chorionic villi because there will be a possibility na sa susunod na pregnancy ng babae, it would be another molar mole pregnancy. You might be asking, but can my patient still use contraceptives post or after HMOL management? Well, according to studies, that woman with gestational trophoblastic disease should be advised to use barrier methods of contraception until the HCG levels revert to normal. Once the HCG level is normalized, the combined oral contraceptive pill may be used. Number five treatment is hysterectomy. It is the removal of the uterus. But the downside to the mother or for the mother is that she can no longer become pregnant. Hysterectomy is advised for multipara mothers. Now, let's move on to the nursing management. As a nurse, ano ang dapat natin kailang gawin? Number one is ensure the physical well-being of the client through accurate assessment and interventions. We are going to review the pertinent history and the history of this pregnancy. We are going to measure the abdominal girth and the fundal height to establish baseline data regarding the growth of the uterus. We are going to assist the patient in obtaining the urine specimen for the urine test of HCG. We are going to prepare for suction, curettage, evacuation of the uterus. We are going to administer intravenous fluids as prescribed. We are going to ensure the physical well-being of the client through accurate assessment and interventions. Number two is we are going to provide client and family teaching. We are going to ensure appropriate follow-up and self-care by explaining the frequent possibility of reoccurrence of the problem or the progression of choriocarcinoma. Also, we are going to explain na yung HCG level ng babae should be monitored for 1 year. We are going to, of course, discuss the need to prevent pregnancy sa babae at sa asawang lalaki for at least 1 year after the diagnosis and treatment. We are going also to inform the client that oral birth control agents are not recommended because they suppress pituitary luteinizing hormone, which may interfere with the serum HCG measurement. And then also, we are going to describe and emphasize the signs and symptoms that must be reported. Like, for example, irregular vaginal bleeding, persistent secretion from the breast, okay? Severe persistent headaches. We're going to teach them and emphasize the signs and symptoms that they must report. These symptoms, okay, may indicate the spread of the disease to other organs. And number three, nursing management is address emotional and psychosocial needs. Siyempre, it may be that this couple have planned for this pregnancy for so long. They have dreamt about this pregnancy, pero ano ang nangyari? RAS pa lang ang nangyari. H-mole lang ang nangyari. Okay? So we are going to address the emotional and the psychosocial needs of the client, especially to the couple, especially to our patient, which is the woman. And so I hope that this molar pregnancy presentation would help you refresh or recall some of the things that we have learned inside the classroom. Once again, this is Rafter Manuel from BSN4 Patricia Benner. Thank you so much for listening.